Hello. Welcome to this training in probabilistic thinking and expert judgments. We note that this video has been produced under a contract with EFSA. The views expressed here do not necessarily represent the official position of EFSA or the European Union. The goal of this video is to demonstrate the process of creating probabilistic judgments about an unknown quantity. Unfortunately, the human mind is not naturally made for judging on quantities. Therefore, this training exercise should support you in performing your own judgments. Heuristics are simple mental processes that help us find adequate answers to difficult questions. These allow us to make judgments quickly in familiar situations. Though often the answers are imperfect, especially on quantities, so several biases might arise. Fortunately, structured expert knowledge elicitation methods are designed to minimize these undesired effects. From now on, expert knowledge elicitation will be referred to as EKI. The elicitation method we will use is called Delphi method. You can think of it as an iterative peer review for expert judgment, which includes questionnaires in multiple rounds, carefully selected experts who respond anonymously to the other experts, and who refine their judgments after seeing the group's feedback. The theory behind shows that the group judgment will consistently improve in quality and stability over the rounds. In EFSABOD, we are focusing on several zoonotic diseases and several steps of the surveillance pyramid. But for the sake of time, I will give an example using one pathogen and one step only. Let's say that we want to estimate what proportion of salmonellosis cases in the community seek medical care, but there is no data available for a particular country. A Delphi study can ask experts in infectious diseases and surveillance to estimate this proportion. Through several rounds of feedback and revision, the group arrives at a consensus estimate, which can then be used in probabilistic models. We do not expect that you know the definitive answers to our survey's question, the true quantity. Instead, we are asking you for a credible range, which should include the unknown quantity with high confidence, and a median estimate, which should neither over or underestimate the true quantity. Just like the questions from the real EKI, in this video's exercise, we will ask you to write down a lower bound L, which is a value you would be amazed by if the true quantity was found to be below L. This is not impossible, just highly unlikely. An upper bound U will be also asked for, which is a value you would be amazed by if the true quantity was found to be above U. Again, this is not impossible, just highly unlikely. And finally, the median, M, which is the estimate for the true quantity for which you judge the true quantity to be equally likely to be above or below. You can think of M as your best estimate of the true quantity. It is not necessary for the median M to be halfway between the lower bound L and the upper bound U. Remember that they are both unlikely values. You should picture both the values of L and U as represented in the image above. In addition, the value of M might not be central in relation to L and U, as you can see in the image below. We also ask you to list reasons why you chose those values. This could be best or worst case scenarios, which explain lower and upper bounds, study results, which you take as starting point of your considerations, and rough calculations or extrapolations following your reasoning, which we call mental models. Please make sure to always explain the evidence or factors behind these. Given your unique knowledge and experience, your probability estimates are likely to be different to those of the other experts. This is natural and does not mean that anyone is wrong. First, provide your own independent assessment based on the evidence and your expertise. In later rounds, consider the reasoning of other experts and update your assessment if their arguments lead you to a different conclusion. However, there are certain things you should avoid while estimating probabilities. I will illustrate these through examples of bad and good judgments and rationales. If I were to give you the following question as an exercise, what will be the average healthy life expectancy of women in the EU in 2050? Good practice is to construct best and worst case scenarios and judge the lower and upper bounds first. This avoids that your following judgment on the median is anchored to one value. Avoid starting with judging the median. This would anchor your judgment of the credible range and will lead you to give a range that is too narrow. After having all three values, it is good practice to ask yourself if you can narrow the credibility range without losing your confidence that the range covers the true quantity. This would increase the informativity of your answer. Avoid using any limits, which are theoretical bounds of the answer. These would not give any additional information on the question. It can feel difficult to assign a range and a median because there's no clear basis for making that decision. This challenge can come from not being used to thinking in terms of probabilities or from lacking a clear basis for your judgment. For example, if there is no available data in your country to answer these questions. However, there should always be some form of evidence or reasoning behind your judgment. A judgment must always be made based on evidence. Please do not use artificial intelligence to develop your judgment nor your rationales. To support you in this exercise, we will provide some guidance. Similarly, in the EFSABOD EKI, we will also provide documents with both general and specific evidence. You should read these to help you form your judgments and rationales. Here are some bad examples of reasonings. When writing your rationales, focus on the arguments that lead you to those judgments and avoid sharing states of mind about the given judgments. For example, I would be surprised if the value was below this, or I think this is the most likely probability, or this is difficult, but I think I would be shocked by this value. You should also avoid listing the estimates given in the judgment, just simply writing the numbers there. L equals 70, U equals 85, M equals 80 years of age. You should also avoid describing what the provided judgment is. For example, this is the result for my region, or this is what I think. Lastly, you should also avoid providing wording that could identify you, your country, your institution, or your role in a way that compromises anonymity. This is the result for my country, Malta, for example. This breaks the anonymity characteristic of the Delphi method. When listing your arguments, distinguish the reasoning of the credible range from the reasoning on the median. Here are good examples. Justification for the upper bound or lower bound would be, let's start with the lower bound, chances of health or environmental disaster or war. Or if a disease outbreak affecting children would happen, also environment with more contaminants in 2050. Or I think COVID affected life expectancy and the value will remain low for some years. And then for the upper bound, we have some examples like prevention measures, improved working conditions, and advances in precision medicine, or lifestyle factors, sports, balanced nutrition. And then we have examples for justification of the median. Remember that these are all good examples. There will be better medical care in future. Increasing retirement age means expectancy to live in health at least few years after retirement. Thus, I expect higher life expectancy in the future. Or, I estimated considering current value in my country and improvement in living conditions and healthcare. This last expert based their judgment on the available evidence and then considered two factors that impact life expectancy. This is a good example. These reasons will help your colleagues understand and consider your judgments. Going back to the EFSABOD EKI, what happens after you provide your answers to our survey? After every expert submits their answers to the same question, we will analyze the collected estimates to estimate overall results for each variable. During the second and third rounds, you will be asked to confirm or revise your responses individually to reach consensus between all experts answering the questions. Contact between experts should be avoided to prevent bias by undocumented bilateral discussions and/or common judgments. Why do we need to define probabilities to estimate underreporting zoonosis? We need probabilities because underreporting is not directly observable. We cannot see the true number of infections, but we can use probabilistic models combining different data sources to infer how many cases surveillance systems are likely missing. Why do we ask you to provide reasoning? Well, the reasoning will be used to stimulate anonymous discussion among experts, explaining the factors that led your estimate may influence other participants' judgments, just as their reasoning may influence yours. This exchange is intended to support convergence of opinions and facilitate the development of a consensus. We will move on to the exercise now. To illustrate the concepts mentioned in this video and make them more tangible, we provide training questions that are unrelated to our study topic. They are for you to train your probabilistic judgments. Just like in the IKI, for this exercise, you should assume that current conditions remain stable over the next year, with no major policy changes, disruptive events, or events affecting country and its inhabitants' daily life. Unless a question specifies age groups, estimates should refer to the adult population. Experts should consider typical behavior patterns and assume that the population of interest resides in the country where the experts work. Your estimates should reflect routine conditions rather than exceptional crises or temporary changes. Please provide an upper bound, lower bound, and median values to answer these questions. How many people out of 100 take the car to go to work in your town? And the second question is, how many people out of 100 are vegan in your country? Please consider that working from home is not a possibility in this scenario, just like it wasn't before the COVID-19 pandemic. Please don't use artificial intelligence to develop your judgment, nor your reasoning. We are not evaluating your answers. The goal of this exercise is to help you practice probabilistic thinking and uncertainty assessment. Here we offer you guidance for your thoughts. You should base your judgments on the available evidence from your country. Consider the following regarding your town. Is it part of an agglomerated area, middle or center, or is it part of a rural region? The areas for living and for working, are they separated, are they mixed or concentrated? And think also about the public transport. Are they dense or sparse? Also, consider the preference for public transport or other means, like walking or using the motorcycle, and the common locations of living and working places. Are they close to each other or far away? For the second question, consider the following about your country. Does the population have a traditional or diverse dietary habits? Are animal-based and plant-based food equally available or not? Also consider that some people choose diets for health, ethical, environmental, religious, or cultural reasons. As mentioned earlier in this video, we provide both general and specific evidence documents to support you in developing your judgments and rationales for the EFSABOD IKI. These include examples of probabilities based on data from countries where values for the different steps of the surveillance pyramid have already been published. Remember to look at those before providing your judgments so that you have a basis for your judgments. All experts should read the general evidence. Specific evidence is different for each of the disease groups. Group 1, diarrheal diseases, includes Salmonella, Campylobacter, Yersinia, and Aztec. All the other groups have different specific evidence. Group 2 for Listeria, Group 3 for Trichinella, Group 4 for Echinococcus, Group 5 for Brucella, and Group 6 for zoonotic tuberculosis. In the EFSABOD EKI, we will also ask you to provide reasoning for your judgments, just like in this exercise. I hope this training was useful and that you feel capable of providing your judgments. Please don't forget to review the general and specific evidence documents before you start the process. These will help you providing guidance for the EKI questions. An expert can give their estimates to one or more disease groups and countries upon agreement with DTU. Make sure you read the correct documents for your case. Thank you for watching.